Welcome everybody, I'm Sergio Genesini, and on behalf of the Venous-Lymphatic Ward International Network Foundation, I'd like to introduce to you the fifth and last educational video of the not-for-profit project dedicated to the coronavirus outbreak and to the venous and lymphatic patients who are then contained at home with eventually difficulties at joining the venous and lymphatic offices of referral. I'd like to start this video, as always, reminding you that this is indeed an educational activity that in any way can substitute the valuable evaluation and recommendation of your general practitioner and of your venous lymphatic specialist of your specific case. This fifth and last lesson is dedicated to venous ulcer self-management, a topic for which you really want to develop a proper relationship with your venous and lymphatic specialist, who has to teach you how to manage that at home in these days of containment. Indeed, this very interesting paper from 2011 is demonstrating how a proper teaching of the self-management of the patient is associated with a significant reduction in the recurrence of the ulceration. In this nice study, they were proposing, for example, at least 1 hour per day of leg elevation, 6 or more days per week in proper compression, 20-25 millimeter mercury or 30-40, depending on the case, proper social support, and again, the importance of a knowledgeable self-management. Don't think this is a topic for few people. 1% of the population actually experienced an ulceration, which means that when you are walking downtown, at least one person out of 100 experience a venous ulcer that we could define as an open lesion between the knee and the ankle that arises in the presence of chronic venous disease and is present for more than 2 weeks. This ulcer has to be considered not just per se, but also with the surrounding skin and the surrounding leg and the other leg as well, and the patient's in his or her totality. For example, in a situation like this, we see that there is obesity, we see that there is lack of hygiene, we see that there is a wrong weight bearing. All topics we have touched in the previous lessons, for which I really suggest you to enjoy the other 4 lessons of this project before enjoying this last one fully. And I really don't want to bore you with too many data, but consider that it's not even 1%, it's 2% of the population if you are considering the elderly one over 80 years old, that are indeed the ones who are now exposed to the highest risk of COVID infection, so being contained the most. So being at risk also of developing lesions or even recurrences that are present in up to 69% of cases. So it's time to act, even if we are contained at home. And time is indeed the acronym of what you should look at when you are looking at your answer, and eventually you have to report your condition by phone to your health professional. You will have to describe the tissue, the eventual presence of infection, the kind of moisture that there is, the kind of edges you have, and the surrounding skin. Of course, your health professionals will guide you through all this process, but let's have a look over here, the major things you could report. For example, the exudate type, the liquid that is coming out. If it is serous, it means that it is a thin, clear, watery. It means that it is in an initial stage of the condition. It could be also described as sanguineous, which means bloody, with blood, which is again an initial stage of the condition that is associated with the creation of new vessels in the attempt of repairing your lesion. Could be half and half, serous sanguineous, so thin, watery, pale red to pink, again an initial phase of healing. But it could be also purulent, which means thick, which means yellow, green, brownish. And this is very important, you notice, because this is associated usually with an infection that will require to be assisted physically by a health professional. Also point out the eventual presence of black areas that could be necrotic areas, which means areas without blood supply that needs urgent evaluation. You could also describe the amount of this exudate. Could be none. So the tissues that you had around your lesion are dry, could be scant, which means moist, but there is no measurable drainage. Could be minimal. Let's say 1/4 of your dressing is wet. could be moderate, from 1/4 to 3/4 of your dressing is wet. Or it could be large, which means more than 75% of the tissue that you put around your lesion is actually wet. You could also describe the consistency. It could be low viscosity, which means thin, runny. It could be high viscosity, which means thick, sticky, doesn't flow easy. You could also smell that lesion, which means that no odor is noted. It could be otherwise strong, full, pungent, fecal, musty, or sweet as odor that you have to describe carefully. When you describe all these data of your lesion to your doctor could get back to you with proper suggestions in terms of lifestyle, in terms of compression, and in terms also of drugs you could assume to facilitate your healing. So remember that you also have very probably a camera in your phone, and that you can take a picture and describe that to your doctor in all the features we have described before. Some tips and tricks. Remember that hygiene is fundamental. So you could think about cleaning not just the wound, but all the leg, using, for example, a plastic bucket, so that you can then wash it properly and reuse it again. And don't forget that in between your fingers of the foot, there is quite a lot of potential dirt that you want to clean as well. We have seen in lesson number 3 the possibility of doing specific exercises even sitting. So I really suggest you once again to have a deep look at lesson number 3 to know how to activate best your calf pump to facilitate your ulcer healing. Compression is the mainstay in ulcer healing. So it's important that in these days you apply proper compression, and you might have some issues with bandages because maybe health professionals are not able to reach out to you in these containment days. Well, know that you could receive another kind of compression through the adjustable compression wraps. These are devices that are really easy to be managed and really effective. Basically, you have a sleeve you can wear on your skin with no pressure, just to protect your skin. So very, very mild pressure, no bothering for you. At the same time, you will apply over that a device that is a Velcro. It is really easy to be applied, as you can see over here. It's like wearing a sash, basically. And then you pull in the 2 different directions, so to align the lines that you see over there. For example, in this case, they are not aligned, and here they are progressively aligning. When you are stretching the material, you will change the pressure. So you can adapt to the pressure that your health professional asks you to have, 20, 30, 40, or 50 millimeter mercury. Be sure you are staying in the range. Like, for example, in this case, it would be too much. It's too stretched, so too much pressure is applied. Then fold the sleeve over the device, and then you can wear your sock on that you can remove easily when you are done wearing the compression tool. You can unwrap the device and simply remove your stocking. I will conclude this cycle of lessons pointing out the amount of fake news we are exposed to, particularly in these days of COVID and in general in the medical world. It has been reported that up to 40% of the medical websites are including fake news that are usually shared 450,000 times. So incredible numbers that are leading us to run a project in conjunction with the Expo Dubai 2020-2021, dedicated indeed to fake news. And this is a call for you to be part of that, because indeed you can go inside this website and report eventually encountered fake news in the venous-lymphatic field. You can report in whatever language, even anonymously if you prefer, and they can be reported by a health professional, but also from a non-health professional. So I really hope you'll join this teamwork, and also, of course, feel free to use this tool, even to ask eventually encountered information you had in terms of their reliability or not to the Venous Lymphatic Ward International Network Foundation scientific community that will get back to you, of course, for free, as all of this is a not-for-profit education project for which I deeply thank all the Venous Lymphatic Ward International Network Foundation components, and in particular I'd like to thank Professor Bottini and Professor Guidici for having provided also a Spanish and a Chinese version of these 5 lessons. And I would also like to invite all the professions around the world who are interested to simply write to us, so to have the slides that are available for free, translate them in their own language, and disseminate them all around, so that in these days of pandemic dissemination, we can at least keep our venous lymphatic patients protected at home in their venous and lymphatic drainage. I'd like to remind you exactly what I reminded you at the beginning of these lessons. Coronavirus has no legs, so don't walk it around in these days. Stay safe and stay properly contained at home.